welcome to the Daily Dose with Dr. Cristin. I'm Dr. Cristin Fitzpatrick, International Healthcare Professional of the Year and Director of the Mediterranean Brain and Spine Center, home to Malta's award-winning international team of specialists. Here's the Daily Dose. We're focused on what truly matters, helping you and your family stay healthy, balanced, and thriving every day.
Hi, this is Rupert from the Mediterranean Brain and Spine Center at Nashar. Today we are with Dr. Cristin Fitzpatrick, and we're going to be discussing with her headaches and migraines, something that all of us go through one day or another. And with Dr. Fitzpatrick, we'll be discussing how it is the best way to deal with headaches and migraines. What are headaches and migraines, Dr. Fitzpatrick?
Okay, fantastic question. So I love headaches and migraines. And I know when people come in and they say this, they go, what do you mean you love headaches and migraines? Well, I love understanding them. I love figuring them out. And then I love making the changes that we can make to be able to squash them. It's one of those things that's so common anywhere that you go. People go, oh yeah, like I have headaches, I have migraines. My mom has that, my sister has that, my cousin has that. And it's such a common thing, but just because it's common doesn't mean it's normal.
Yes.
That's something that we say all the time in here. Yes, it's very common. It's not normal. Okay, many of these things we get into, and helping figuring these out, they're one of my favorite things to work with because we really get really fantastic results with our care here.
But why do we get headaches and migraines? What triggers it?
Yeah, there's so many different factors to it. So a lot of times there's something called a tension headache. Now, tension headaches are super common. These are caused from things like poor posture, the tech neck that we're having, chronic stress, postural problems are such a huge source of putting pain and stress onto the nerves around the cervical spine. Those are super common. We have other factors such as hormones, lifestyle factors. So we get into diet and nutrition, supplements, and honestly, when we have a combination of so many different factors, they all add up together and they all create that symptom that we have, that pain symptom that everybody talks about, and it manifests as a condition. So essentially what we do is we have to look at a patient, we have to look at all the lifestyle factors, we have to see what's happening biomechanically in the patient, neurologically in the patient. We can get into the differences between headaches and migraines at a little bit later stage. But we need to understand what all those factors are in a patient that's creating that symptom to happen.
So, okay, you already prompted me to the question, so what's the difference between a migraine and the normal headache?
Yeah, so headaches is something that happens below the neck. Okay, usually the causes of that is something that's happening below the neck. When we talk about migraines are happening above the neck, and typically the symptoms associated with migraines include things like sensitivity to light, sensitivity to sound, nausea, sometimes dizziness. And these factors, the symptoms in the areas in the brain that those sit in are really deep inside the brainstem. And usually what happens is something gets out of balance. So in between the right and the left side, there's some type of miscommunication in what's happening in the brainstem. So that's where a migraine comes from. These are the ones that really shut people down. They have to go home, they have to go in a dark room, they have to turn out all the lights, they're sensitive to certain smells. All of these types of factors, these just get a lot louder for patients. So sometimes in many cases, what I see is you'll have a tension headache where we don't do something about the pain, and all of a sudden the brain says, hey, you're not listening to me, and it just turns up the volume, and that's when it turns into a migraine. In many cases, what I find over here is a lot of these things are just mismanaged or not even managed at all, and people think that that is just normal for them. To be honest, there's no genetic marker for tension headaches or migraines, right? A lot of these things are lifestyle related. So yes, I do say this sometimes. It sort of breaks the ice with patients that I love headaches and migraines. I find them very I find them very simple to break down, and usually the treatment process will take some time. But once people figure out what all of those different factors are in their life and in their body, that it's causing it, right? So many things are cause and effect.
Yes.
And these signals that we have, that pain signal that sometimes people do not find very pleasant, that pain signal is like those signals you have in your car.
Yep.
Oh, you need more fuel. Oh, check your oil. Oh, your tire pressure is low. When we have those pain signals, we need to realize that pain is not a bad thing. That pain is a signal that our body
has. What we need to do.
It's telling us there's something wrong.
Yeah.
And we have to listen. We can't just ignore it, because the longer we ignore it, the more it's going to build up. And usually those headaches will build up into something that's a little bit more complex neurologically.
Yeah, most definitely.
Yeah.
You know that unfortunately headaches and migraines happen in the worst situations possible when you are out, for example, when you are maybe enjoying yourself, and really wouldn't want a headache or a migraine to hit you at that point. But is there something that someone can do so that we can alleviate, something simple that someone can do that we can alleviate the migraine pain or a headache pain, so that one can continue doing his normal day?
Yeah, this is a great question. Where I come from, when we talk about this, we say a headache is not an aspirin deficiency.
Yeah.
Okay? You don't have it because you forgot to take your medicine. I think this is a very important thing to note. I think during those times, these are the signals that your body tells you that it's too much.
Yeah.
Okay, so it does happen at those big moments. It does happen when you're supposed to be at some event with the kids. It does happen when you have a large business proposal that you've been working on, or a big event that you have to go to. And usually it's because your system is overloaded and your system is telling you, no, this is too much. You need to go home and get in bed. So I'm not opposed to some type of intervention. We do have medical doctors that work here as well, because obviously we have modern medicine. We have all this technology and science that we can use. But if we squash that pain and cover that up and keep pushing through for longer and longer, it will manifest into some type of other condition, something more complex. So what I would really recommend is figure out what's going on, right? Let's listen to those signals. Let's see what your body is telling you. Sometimes when we ignore those, other things are gonna pop up.
Most definitely.
Yeah.
So for the people who are watching us right now, those chronic cases, where you just mentioned even before, you need to switch off the light, how can they reach you guys so that you can guide them to do something about this problem, because it can get to be a very massive problem in someone's life?
Yeah, so essentially what we do, and I tell patients, this isn't a huge long-term commitment. Essentially what we want to do is we want to just start with an initial consultation. So there's many different ways to be able to contact the clinic, through the website, their social media channels. Sometimes people will just reach out to me personally as well. And those types of things, I always say, let's start with an initial consultation, figure out what's going on, right? Once I see your information, your health history, what the factors are, and we can do some exams on there. So doing a full cranial nerve exam is very important. Neurodiagnostics to us are super important, because they show us what's happening in the brain, and they give us a tool that allows us to do something to be able to correct where that dysfunction is. Typically, once we have that, our journey that we have, we can put a time frame on it. So in our training that we have, it's all about a diagnosis, a prognosis, and a treatment plan. So even if you don't know what those words mean, essentially we need to identify the problem first. We need to say, okay, based on this problem and all the health history, what are our expectations on how long this is going to take? Is it going to take 4 weeks? Is it going to take 4 months? Is it going to take 4 years? Is this an ongoing thing we're going to have to work with? right? And then our treatment plan is our way to go about it, right? Once I present that to patients, they go, okay, I can do that. That sounds reasonable, right? We want something reasonable that fits into our life to be able to do that. So I always say, if you don't know your options, then you have none.
Yes.
Okay, so this way we open up the options, and with the team that we have here, we have many different healthcare providers. And what we really emphasize in the clinic is it's not about us. It's not about me. It's not about the next doctor. It's not about the therapist. It is about the patient. So depending on what the patient needs, depends on where we're going to guide you to.
Yeah.
And that type of approach, when we focus on the patient and whatever that patient needs, they're going to get better.
For sure. Thank you, Dr. Cristin. This was very enlightening. I mean, I think that people who are watching us right now can relate to what you just told us. So thank you very much, and I hope that you'll have people that you can help about this thing, because migraines and headaches are something that we're living with every single day.
Yes, and we don't have to do that anymore. I'm super happy to help. Sometimes the patients reach out to me themselves. Sometimes they gift the visit from somebody else, because it goes sometimes beyond the patient as well, and how it impacts the life. Thank you so much for having me.
Yes, for sure. Stay with us. These podcasts, these interviews are important even for you guys to understand how we can help. We're here to help. So stay with us.